Health Station recognized the need to cut a focus for information management and automation engineering within the healthcare space. Our approach is to 1. Dimension the problem space into its vertical and horizontal planes and dig deep through the inpatient and outpatient service modules down to prescription management and clerking module, while connecting the information access dots at the horizontal plane. 2. Lower the initial cost of solution ownership to 0 for our clients.
The speed of business has increased at an exponential rate, and the world of innovation and technology is constantly working to make our lives much easier and better. That's why at Health Station Limited, we offer healthcare solutions and are committed to preparing hospitals and health institutions to meet current and future challenges through leveraging on IT. At the advent of our journey, we asked, how could services in hospitals be delivered more effectively to reduce costs, improve quality, and extend reach? In response, we introduced Health Station's Hospital Management Information Service, HMIS, for hospitals and health institutions in Nigeria. As an ICT company, Health Station Limited is focused on providing value-added hospital management information services to hospitals in Nigeria with deep industry expertise and experience, hence empowering healthcare service providers to render services to their patients in a sustainable, consistent, scalable, and cost-effective manner. As against the old ways of hospital management practice that is filled with clutter, automation is the new benchmark.
The beauty of automation for hospital administration is huge. We cannot really be overemphasized. It is something that has, you might say, revolutionized the concept of hospital administration. It has made services faster. In fact, it has improved the integrity of data.
What deters patients from going to public hospitals is just the delay. With this automation, we are able to reduce the delay considerably.
I made the payments very easy. Patients paid, and there was no issue of duplicating receipts.
And since the introduction of Health Station's HMIS, we have successfully implemented top-down automation at 4 leading teaching hospitals in southeastern Nigeria on fully financed public-private partnership PPP arrangements.
We invited several companies. About 4 companies came and presented, and we had a team that studied their presentation, studied their modalities, studied the menu, and we found that Health Station is the best.
It's been nice in the sense that recently I have less job in trying to get my triage from the overall introduction of my patient through the nurses down to me doing the appropriate clerking for my patient, and I sent my results appropriately to the various labs as indicated from the patient presenting complaint, and the results I get wonderfully when I want, and it makes me even make my prescription faster by sending my prescription direct from here, the consulting outpatient clinic, down to the department of information. Patient can easily pick their drug. So with this, it has been an overall improvement in terms of me managing my patient, and in terms of my patients getting the necessary input of what they came here for.
Using the system HMIS, we give the drugs to those of them at the sub-store. So if you really want to check the onward transmission of drug from main store to sub-store to other units, you can easily monitor that. And not just that, you will also know which pharmacist performed a particular activity. So it helped us to manage that.
On the side of accountability, we discovered that the system on its own monitors my staff. I don't need to stand up here to begin to move around the revenue point or the various offices where these revenues are being generated to take any person. Right here on my table, with the system before me, I monitored all of them. I monitored all inflows into the system. And if I want to generate any form of report, be it daily reports, be it weekly, be it monthly, be it past week's report, it is done automatically.
It really improved our IGR by more than 60%. We didn't increase the price of our services, but rather we're able to block a lot of leakages.
Within the first 1 month of using this, the first thing we notice is that the way the accounts just jumped up, and then everything is so transparent. Everything is so before now, the system the way it was before, you take a long time to actually track or trace how resources are going or how money is going or moving. But now it is so easy. Everything just with a click away, you can see everything. Now the eventual effect is that we'll have more money in the kitty to buy the things we need to run the household, which other thing we didn't want to purchase. Now the decision making, of course, is pretty simple. You cannot take a decision if you don't have money to back it. So we easily saw how much we had and what our cash flow was like. So we're in a position to project and to purchase new equipment.
Overall, Health Station's Hospital Management Information Service has been designed to effectively meet the expectations of the client in terms of providing real and measurable value, implementation success, cost effectiveness, and deployment within time frames. To achieve that, several critical factors have been identified. We focus on carefully monitoring these factors and proactively identifying and mitigating against potential risks. We provide a dedicated team from project planning to the commissioning phase of the project. Similarly, we retain our customers by forming strong professional bonds with them and by providing excellent after-service support.
The MOU we signed with Health Station, basically a private-public partnership agreement. In this agreement, this partnership, the Health Station supply the hardware, all the materials we're using, maintains it within the period of agreement, and takes a certain percentage, and they have their staff on ground to train our health workers, assist the health workers, and ensure that this that the system is working despite the little percentage the health station takes.
The system recommended itself to Nnamdi Azikiwe University Teaching Hospital. They came, one of their big officers came back for something. He came to brought a relative to the hospital, and then as he was praying, he noted how the thing was working. So they quickly went back and told their chief medical director. Then they called me, and I told them that this is the system to use because they are there now.
It is an experience which I expect institutions that have not ventured into it to venture into it, so that you tell the story to yourself.
At Health Station, we are driven by values and aspirations that transcend commercial experience. For every engagement we've had so far, our experience is characterized by a deep sense of fulfillment and pride for being part of a positively disruptive success. Automation is the next big thing that can happen to your hospital or health institution. The testimonies of our satisfied clients are a valid proof to that. At no charge, we invite you to have the Health Station experience.
Health Station, transforming healthcare service delivery in Nigeria through cutting-edge ICT solutions.